Here's everything important to know about symptoms, diagnosis, and treatment for an ACL tear. First off, let me tell you what the ACL is and how it gets torn. ACL stands for anterior cruciate ligament, and it's a very important ligament that's inside the knee joint. Here we have the right knee, and if you move the kneecap aside, deep inside the knee joint, you can see two ligaments. The one that is right in the front, this one that I'm touching right here, is the ACL. And on the back side, there's another one called the PCL. PCL stands for posterior cruciate ligament. Now, this ligament is responsible for holding the thigh bone to the shin bone. There's other ligaments that do that. You have one on the side right here called the LCL, and then you have one on the inside called the MCL. These ligaments all get tensioned differently depending on what position the knee is. So they're responsible for holding the bones together during movement with loads. So if you think about squatting or taking a step up or downstairs, you're going to bend your knee while there's force being applied through the joints, and that joint has to be held together by all of these ligaments. The ACL, the way that it tears, is when you're putting too much force through the knee joint in a bent position like this, and then if there's an inward motion too, it not just bends forward but also inwards, that's the direction of the ACL. It runs from outwards to inwards, from the back to the front. And so when you're bending like this, you're really tensioning it if you're going inwards. If you tend to move like this, because that's the way that you've figured out to move, or your muscles are holding you in a position to where you're moving in that direction because of muscle imbalances, then you're setting yourself up to consistently tension the ACL, and over time it weakens, and this can cause it to tear. I'll tell you more about muscle imbalances towards the end of this video. I've got a lot of information on that. That's actually what I talk most about on my channel. And I've got programs with lots of information here on YouTube as well to help fix the muscle imbalance so that we're not feeding into it. But let me tell you about the symptoms that you'll get if you have an ACL tear. The first one is going to be a pop sensation. People often have like an accident that happens, a sporting accident, a motor vehicle accident, bicycle accident, a motorcycle accident, or just a bad fall, like you stumble somewhere, you trip and fall, or somebody falls into you. They fall into the side of your leg and cause your knee to do that forward bend with an inward motion. And that can cause a pop sensation in the knee, followed by swelling. It's usually immediately followed by swelling, like within minutes afterwards, the knee just starts to not feel good, it starts to hurt, you have some swelling visible. Then you'll also have a loss of motion associated with the swelling. So you can't fully bend your knee like you can your other side, or sometimes you have trouble straightening out your knee like you can the other side. Other symptoms include inability to bear weight through that leg, like you can't stand on it because it hurts. You might also get some clicking or shifting sensations inside the knee joint. That happens because you've potentially lost a connection of that ligament, and so now your knee is going to be a little bit loose. It's not as stable, and so the joint actually jostles around a little bit, causing some clicking or popping sensations. You might also get a buckling sensation, and what this is you might just be standing around and all of a sudden your leg feels like it wants to bend, like it doesn't have the strength to just hold your normal standing position. It just gives a little bit. That's called buckling. Pain at night is another symptom that happens if you have an ACL tear. Some people feel okay during the day, but when they go to sleep, that's when the pain gets especially bad, and it doesn't let them fall asleep, or it wakes them up in the middle of the night, and it doesn't let them get a full night's rest, which is important for healing. Let's talk about the diagnosis of an ACL tear next. The number one way that it is diagnosed is through an MRI, a magnetic resonance image. What that is they'll put you into a tube where they use magnets to get a picture of the inside of the knee joint, and they're looking at the connection of that ACL. After they do this exam, a doctor will interpret the results based on the images that are generated from the machine, and then they're going to grade your ACL tear based on a 3 grading system. Grade 1, a grade 1 ACL injury, it's not really a tear, it means that the ACL was just stretched out and it's inflamed and irritated as a result of that. Grade 2 is that there's a partial tear. It's not completely torn, but it's partially torn. So that's going to involve a certain amount of healing. And then a grade 3 tear means there's a complete tear. It is no longer connected. Other tests that may be used by your doctor are hands-on tests during an examination. The most common one is called the Lockman's test. That's where they have to shift your knee a certain way. All of these involve knee shifting. The second test is going to be an anterior drawer test. They're going to be pulling on your knee forward. All of these are designed to tension the ACL, and some can be painful sometimes depending on how aggressively the test is done. Another test is called the pivot shift test, which is one that involves motion as they're shifting your knee. And with these tests, you have to let the doctor feel it on you to get a good idea, but usually they're going to resort to an MRI to get an idea of the image of the ACL inside your knee joints. Once you've been diagnosed, then the doctor's going to be recommending some treatments to you. Let me tell you the most common treatment pathway that you'll find if you go to the doctor for an ACL tear. Number one is they're going to offer you anti-inflammatory pain medications. What I mean by anti-inflammatory is there's a part of the medication that helps with inflammation, so the idea is to get the swelling down a bit, but it also helps out with pain, so it gives you some pain relief. These are, of course, short-term pain solutions. They're only trying to get you comfortable while the swelling goes down and hopefully the ACL can begin to heal. Sometimes they'll offer an injection as well, which they're injecting pain medication and anti-inflammatory medication. Same idea, they're just trying to get the pain down and the inflammation down, but they're injecting the medication right into the knee joint so that it goes to where it needs to go, rather than if you take it by mouth, it has to run through your whole blood system, it goes all over your body. There's different side effects involved. Usually at that point, if you're not feeling better on your own, if the ACL isn't healing on its own, then they're going to send you off to have ACL surgery. They're going to recommend that to you at least. You might see a specialist at this point. You might have already been working with a specialist. What I mean by specialist is an orthopedic surgeon who does ACL surgeries. And this surgeon is then going to discuss the treatment options with you based on what they can do, on what they're trained to do, which is surgery. There's different types of ACL surgeries out there. The first most common type is a reconstruction surgery. And what they're doing there is they're reconstructing your ACL. They're giving you a brand new ACL based off of what's available in your body. Usually they'll take a section of this tendon or ligament right here, or this one right above or below the kneecap, or on the side and back of the leg, they'll take a section of the tendon of a hamstring and they'll use what's called a graft. That's when they take that section of tissue and they use that graft to make you a brand new ACL. They'll drill some holes through the bone right here in the direction that the ACL travels, and they'll pin down the new ACL with sutures and with screws. They have all their devices that they use. And the idea is to give you an even stronger ACL than your original one, and they're very good at doing this. The second type of surgery that's done is called a primary repair, which is when the ACL detaches from the bone. Where it attaches in the bone, they'll reattach it because technically the ACL isn't torn, it actually just broke the bone off. So it's a little bit of an easier fix. If you're lucky enough to have that kind of an injury, then you'll have that kind of a surgery, a primary repair. There's a brand new procedure that's been out for just a few years. It's called the Bear repair, or the Bear procedure. And BEAR is the acronym. The B stands for bridge, E is enhanced, A is for ACL, and R is for repair. Bridge enhanced ACL repair. And what this is if you have the torn ACL, they're suturing or tying the ends back together. And then they have this special marshmallow looking device that they inject with your own blood, and they wrap it around your torn ACL because it's supposed to help it to heal faster. This procedure is brand new. They're rolling it out in certain cities depending on your surgeon's expertise and experience and training on this technique. Sometimes your orthopedic surgeon may send you out to do physical therapy before trying surgery. They may give you a month or 2 months of physical therapy treatment in hopes that your ACL will improve and possibly heal on its own so that you can avoid having a surgery. I have concerns about this. Let me explain to you why. Usually when a surgeon is sending you to a physical therapist, they send you to the physical therapist that they know and that they work with a lot. And surgeons, especially those that do knee surgery, heavily work with physical therapists who are great, who are specialists at helping people recover from a surgery. That's why they work together, because the surgeon does the surgery, but they don't do the rehabilitation. They send them off to the physical therapist to go to weekly rehabilitation sessions where they're working on knee bending and getting back to moving normally, getting back to walking, all those things. But if you haven't had an ACL surgery and you're trying to avoid getting a surgery and you go see one of these physical therapists in a setting where there's a bunch of other people around you that have had a surgery, then think about this. You're not working with somebody who's specialized in helping you avoid surgery, because the process for avoiding surgery is different than the process of rehabilitating after an ACL surgery. I know this because I'm a specialist at helping people avoid ACL surgery. I do this all the time here in my clinic. In fact, I've packaged my treatment approach into the ACL Tear Recovery Program. You can learn more about it through the link in the description below. And I've got tons of videos here on YouTube that I've organized into a playlist for you. It's called the ACL Tear Help playlist. You'll also find it in the description down here below. I put all the videos together for you because I want to make it available for you to be able to fix your ACL without surgery, because it's very possible. We help people do it all the time. But you got to be seeing the right kind of specialist. And if you're seeing a physical therapist who deals with people that are recovering from surgery, they tend to work with the surgeons, they see a lot of surgical cases, then that healthcare provider is very likely not going to have the training to be able to help you avoid ACL surgery. And what tends to happen is they'll do the best they can with what they know. They won't tell you no. They'll make sure to treat you as best as they can in the best to their ability based on their training. But if it doesn't work out, they will be quick to say, you know what, maybe physical therapy treatment isn't for you. I know you're trying to avoid ACL surgery, but you keep swelling, this isn't working, you need to go back to the surgeon and see about that surgery. And that happens all too often, and I wish I could see those patients sooner, because we see them after the fact. We see people that have an ACL reconstruction that ends up failing. It doesn't work out well for them. They still have pain afterwards, and they can't get back to being active again and being healthy. Then they come to us because they don't want to have the second surgery, and it's at that point that we're fixing things that are not addressed through surgery or medications or injections or through typical rehabilitation like you would do after surgery. There's a whole different process that requires a different specialty.